All right. So today's topic is nutritional assessment. At the end of this lesson, you should be able to define nutritional assessment, nutritional status, and other key terms. You will also be able to outline the four main ways in which nutritional assessment can be done and some examples of each. You also will be able to know the proper way in which to take somebody's height and their weight, and also their hip and waist circumference. All right, so let's get started. Some of the key terms that you will see in this presentation is food, nutrients, nutrition, etc. And food, and in this PowerPoint, it's very heavy in terms of content, so I will be going through as quickly as possible and just giving you an overview of what the presentation is about. It is expected that you will go back after watching this video, go back to the PowerPoint and view it on your own and read everything in detail. And if you want to use other resources to back up any information that's here, that's fine as well. So, food is any solid or liquid substance which, when taken by the body, provides it with the necessary materials to enable it to grow, to replace worn out and damaged parts, and to function normally. Because a lot of persons can eat anything, but if it doesn't provide the body with nutrients, then it is not food. Nutrients now are molecules found in food that the body uses to function correctly and to stay healthy. And nutrition is the study of these nutrients and their relationship with food and living things. A diet is the food that the person normally eats every day. So whatever it is that you eat, that is your diet. Now, special diets are the ones that you would use to either reduce weight, or because of a certain type of medication or your health status, you might remove or add certain foods to your diet. Or you have diets in which you focus on a nutrient, and either eat more foods that come from that provides that nutrients in certain amounts. And health is a state of being a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So health encompasses even more than just not being sick, right? But it speaks about your mental health, your social health, and your physical health. You could even go further and talk about environmental health and financial health, but we're going to keep it simple for now. All right, so nutritional status. What is nutritional status? Nutritional status is a measurement showing if the nutritional needs is being met. So we know that men and women require different amount of nutrients, right? And also those toddlers, newborn babies, children, elderly people, they all require different amount of nutrients based on where they are in the life cycle. And nutritional status is just the word that we use now to say, are you healthy nutritionally? Are you lacking in one or more nutrients? So nutritional status is how healthy the body is, or how nutritionally fit an individual is. It is influenced by the quality and quantity of food intake and the person's physical health. To find the nutritional status of a person, so to find how healthy somebody is nutritionally, or to evaluate their health, a nutritional assessment must be done by a qualified health professional such as a dietitian or nutritionist. A nutritional assessment now is an in-depth evaluation of data related to the individual's food and nutrient intake. Not just that, but their lifestyle and their medical history. And you will find that all of these have to be used together to get a complete analysis and an accurate analysis of what is going on with that individual in the nutritional assessment. The purpose of nutritional assessment, as you can see, is to identify individuals or population group, because nutritional assessment can be done on a wider range than just on an individual basis. Right? Ministry of Health sometimes do a community to see what the deficiency diseases are going to be. And deficiency diseases are basically diseases that come from having a lack of a nutrient. Right? So if you ever heard of night blindness occurs when there's a lack of vitamin A. Anemia occurs when there is a lack of iron. And these are called nutritional deficiency diseases, right? Nutritional assessment can also be done to identify individuals in the population that are already malnourished. So it can determine those who are at risk for it and those who are already malnourished. And in Jamaica, we use the term malnourished very loosely. But malnourished or malnutrition is when you have over or undernutrition. Meaning, when you say malnutrition, you normally mean people who look slim and very slender and look like they're very frail, right? But that's the part of undernutrition, when they are lacking one or more nutrients. Now, malnutrition can also mean overnutrition, when you are consuming too much of one or more nutrients, and most times this occurs in the form of obesity, too much fat in the diet, right? Diabetes, hypertension, heart disease, right? Nutritional assessment also, after you have gotten the results from this, it can be used to develop healthcare programs to meet the needs of the community or the individual. You can see now that the Ministry of Health is doing Jamaica Moves campaign, when they are trying to get Jamaicans to be more active, because they realize that Jamaicans are developing a lot of the non-communicable diseases. And non-communicable diseases are diseases that are not caused by an infectious agent in the air or by touch, but is diseases that is caused through lifestyle and sometimes genetics. This cannot be passed on from one person to the other by touch. All right. Now, nutritional assessment can be divided into 4, sometimes 5 parts. Right? You have A, B, C, and D. And some will go as further as to say E, which means ecological methods, but we're not going to go into that one in this presentation. We're going to just focus on the first 4: A, B, C, and D. A is anthropometric methods, B, biochemical methods, C, clinical methods, D, dietary evaluation methods. Now, let's just go into anthropometry. What does anthropometry mean? Anthropometry is a measurement of the human body, primarily height, weight, the arm and head circumferences, and skin fold thickness. These measurements can evaluate the progress of growth and development in babies, children, pregnant women, measure changes in the body composition over time, and detect undernutrition and overnutrition in individuals. These measurements, when you take these measurements now, they are recorded and compared with standard charts. So let's begin with the first one, height measurement. Now, when you're measuring someone's height, there is a equipment that is used called a stadiometer, and this stadiometer has a movable headpiece. As you can see in the picture, you can move it up or down. The person is supposed to be flat-footed. No shoes should be removed. This hair, if hair is up in one or in the ear, it should be pulled out so that the the ruler that is above the head can firmly fit on top of the head to get an accurate height. They should be looking forward, shoulders relaxed, back straight, posture up, and you can get an accurate reading for their height. Now you have weight measurement. Now weight can be measured different ways, right? Nowadays you have the digital scale, you have a bean balance, which is the first picture, and the second one, and you also have spring scales, right? Spring scales were normally used for younger kids back in the day. Not sure if any hospitals still use those, but basically person should remove all heavy clothing. The best weight that you can get, the most accurate weight, is if the person is fully naked, but a lot of times we're not able to be in our birthday suits to take our weight. So you remove all heavy clothing, right? Shoes, jewelry, if you're here having, will wear a lot of heavy braids sometimes, so you won't get that accurate measurement, right? This lady standing here on the scale, she's doing something wrong. She should not be looking down at the scale. She should have her hands at her side and should be completely relaxed for the weight measurement to be accurate. Using the beam balance, which is basically moving that little thing across the top and the bottom of this scale to get the weight in kilograms. You have to be trained to use it. It can be quite complex to someone who has never used it before, and so it would be good if you're either trained or you see it being done. Now, how important is height and weight measurement in seeing how nutritionally fit you are? Here is one of the ways in which height and weight can be used, especially in adults. We can plot it on a BMI chart. Now, BMI means body mass index, and it's commonly used to classify underweight, overweight, and obesity in adults. Here's an example of a BMI chart, and if you look, you will see weight. You have it in pounds at the top here. And with different BMI charts, the weight and the height can be at different places. So you just need to look where it is, right? You have weight in pounds here, and you have the weight in kilograms. You have height here, you have it in feet and inches, and you also have it in centimeters. Now, how do we use a chart like this? For example, Julia is 5'2", 5 feet 2 inches, and she weighs 130 pounds. What is her BMI? Basically, what you would do, you look for 5'2", and then you try to find 130 pounds. I think we're in that line. So my BMI would be 24. So the 130 pounds right in line with the 5'2", 24. And then you will look at the color scheme and determine if I'm in the healthy range, and I'm in the healthy range. Suppose I was 160 pounds at 5'2". I would be in, 5'2", 160 pounds. I would be here in yellow, which means overweight. And then you can see, so you can know if you are underweight for your height, if you are healthy at your right weight for your height, and overweight meaning you're overweight, you're at risk of being obese, and then you have extremely obese. And there's a weight range for each height, so you can know that you don't want to be too close to underweight and you don't want to be overweight. So you try to find that right balance in between. All right, so I'm going to put in the discussion you using a BMI chart now to find the different heights and weight. All right, so you can easily, if it is that the BMI chart is not in in color, you can know what is the weight range, the category that they would fall in. And a BMI chart is used for adults. Some places use it for 20 and older, some start at 18. Right? So if the person falls below 18.5, they are classified as underweight. If they are between 18.5 and 24.9, they are normal. 25 to 29, they are overweight. 30 and above, they are obese. And the higher they are on the BMI chart, meaning the more they move up to the classification of obese, underweight, etc., they will be at risk for developing lifestyle diseases, right? Non-communicable diseases such as type 2 diabetes, cardiovascular diseases, and then if this persists, then even death. So that's how we use the BMI chart now to determine someone's nutritional status. However, because you have people who have different muscle mass, and muscle mass is weight, right? You might find that somebody who, for example, a bodybuilder, somebody who do a lot of weight training, might be heavy for their weight, but it's not fat that they have, it's muscle, right? So in that case, a BMI chart would not be an accurate reading, because they might come off as obese, but they are not fat, they just have a lot of muscle. So in that case now, a BMI chart would not be the only assessment that you would use for them, because then it wouldn't be accurate. Now, since BMI chart is used for adults 18 and over, what do we use for children, right? And the reason BMI chart is not used for kids is because they are still growing and they are going through puberty, and their body is going through a lot of change, and the amount of fat changes with age, right? And the amount of body fat differs between boys and girls. So if you use BMI chart, trust me, it won't be accurate, because you might use the BMI chart to do an assessment on a teenage boy at age 13, and over the summer he has a rapid growth spurt, right? Then the assessment that you had before would not be accurate. So what they'd use for kids and children, I'm not seeing it here, is a growth chart, right? And I think I have it in the PowerPoint a little further down, so when we reach there, then we can talk about it. But keep it in mind, growth charts are what they use to measure children 18 and below. Other anthropometric methods include mid-arm circumference, skin fold thickness. So mid-arm circumference would be here. Skin fold thickness, which is using a caliper, right? Head circumference, head and chest ratio, and hip and waist ratio, right? With hip and waist ratio now, this is to identify individuals at increased risk for obesity-related diseases, diabetes, stroke, and heart disease due to the accumulation of body fat. We know that our hips should be wider than our waist, but sometimes that's not the case because of the amount of belly fat that we have in that area, in our midsection there. Now, we can take these measurements and use them to know if you are at risk. And this is important because where you store fat can be a predictor of health risk, right? Because you know that people's body have different shape. They have a lot of different shapes. And some persons store their body in their lower body, meaning like their thighs and buttock, and some persons store it in their upper body, their tummy area, and so forth. And these are just to show that, you know, where you can be at risk for certain diseases. So if somebody's waist is 34 inches and their hip is 43, alright, so imagine somebody's waist is 34.5 inches and their hip is 43 inches. How you would find the waist hip ratio basically is to just look on, you would divide, as you can see in the corner over here, you would divide waist, the 34.5 inches that you get, by 43, and that would give you the decimal of 0.8. Alright, so remember when we were talking about anthropometry for children, and we were talking about growth charts, and that basically when you get these measurements from the different parts of the body that you will measure, right, you put the measurements on a standardized chart, and then you will see if your child is growing at the normal rate for that age. And you have different types of growth charts. You have height for age, weight for age, and weight for height. The height for age, right, it tells you if your child is growing at the normal, growing normally for the age, and this can indicate being underweight or what we call stunting. Weight for age, see if children weigh at the normal range and the standard weight for their age, and this can show either obesity or wasting, so being underweight as well. Weight for height is like their BMI chart, and this can indicate the current nutritional status, and it can be useful for screening children at risk and for measuring short-term changes in the child's nutritional status. It can also indicate if there is wasting going on or obesity. Here's an example for a length for age and weight for age chart for boys, and these charts are normally grouped in based on their age, right? So this chart is for a baby boy from birth to 36 months, and then you would have another chart now from 36 months go up. All right, and this is how they weigh kids. Remember I was saying that you have the spring scale, right, but not much persons use this anymore. They use the beam, the balance beams mostly, right? And then you have other types here. Here they are measuring the baby's length. Remember, it's not height for them because they are not walking yet, so it's their length that they measure using a length board. All right, so moving on to biochemical. Biochemical assessment involves conducting a number of laboratory tests to find out what is happening to the body internally. Common tests are based on analysis of blood and urine samples. These samples contain nutrients, enzyme, and metabolic substances. Tests to show glucose or iron content to help to show disease-related problems with nutrition, including complications such as diabetes, anemia, high cholesterol levels. Many people have such tests when visiting a doctor. A urine test checks blood pressure and breathing rate are all examples of biochemical assessment. So biochemical assessment, as it says, is just testing what is going on internally. So anthropometry, your measurement of the different parts of the body. Biochemical, testing of tissue, blood, urine, fluids, all of that, all come under biochemical. C, clinical. Clinical now is looking at, is like a physical examination of the body. So signs of the general appearance of like your tongue, your eyes, your nails, your muscle tone, your skin, checking swollen glands, heart rate, blood pressure, So blood pressure can fall under biochemical and also clinical. And reflexes. Having the tongue, eyes, mucous membranes, and glands are all examples of clinical assessment. And this is what most people use sometimes to determine if somebody is healthy. You look on them. You look on the appearance of their skin, of their eyes, to see it yellow, them teeth white. You know, so most times this is the one that we use. So you can see when you go to a doctor and they're looking in your eyes and in your ears and in your throat and in your tongue, and all of these can tell if you are healthy or not. But the thing though with clinical assessment is that you have to have background information about the person, because sometimes certain things might run in the family that might give an ill-shaped item or part of the body, and you might assume that it's because of a certain thing.